Okay, I thought I'd address the ongoing situation with the COVID crisis to have a little change of pace from the ongoing election issues. Um, One of the interesting things that's developed, I just heard that at the end of last week that the Prime Minister of Sweden has expressed that he thought that they'd made the mistake on the way they've been handling the COVID-19 issue, and I guess they are planning on going more to the lockdown approach like used in the United States and most of Europe. It's interesting, though, if you look at a comparison I've done before on this subject, is that since Sweden and the state of Michigan both have approximately 10 million people in it as a population, it's interesting that and Michigan has been known for ongoing lockdowns and protests and everything about it, whereas Sweden has been fairly open, almost ignoring the whole situation. We have about 482,000 cases in Michigan at that time I did this study last Thursday versus 348,000 cases in Sweden. So there's actually more tested infections in Michigan. And then when you look at deaths, which is a more concrete number, there's 11,588 deaths in Michigan as of that time versus 7,800 deaths in Sweden. So when you look at, and the death numbers, I guess, are more objective in some sense. At least the testing may be partly due to just, how available testing is in a given jurisdiction. But it goes to show you that Sweden has not suffered more from COVID due to their more open approach than say Michigan has with its more restrictive approach. And of course, the economic damage to Michigan was far greater than what happened with the Swedish policy. Now, if they're going to change policies now, I sort of ask why. I got motivated to do this particular video today because I saw Chris Christie doing a video saying wear a mask. And it occurred to me, well, where I live, which is perhaps one of the more open states in the country, everybody's wearing a mask in public. If you go to a grocery store, to Walmart, to out to a restaurant, the only place where I see people not wearing masks is when they're in a subdivision walking down the sidewalk by themselves or with somebody from their household. And even then, people pretty much veer off and don't get within 6 feet of each other when they pass, or else they pass it so quick it's a few seconds. So the point I'm making is people are following mask policies pretty well, and yet the number of cases have varied independently, and of recent months have been going up substantially. And yet, so it doesn't seem to me that the mask thing is very effective. That's not to say that you shouldn't wear a mask, but I think you should see it as a pretty minimalistic effort. I would say a seatbelt in the car is probably more effective in protecting you from injury than a mask is to protect you from COVID. Let's put it that way. It may be that other factors are involved, like I'm wondering to what degree the mask is being used like a security blanket and people maybe aren't using hand sanitizer sufficiently or cleaning surfaces and so forth. I'm not accusing anybody of that. I'm just saying, is it possible that other aspects of the protocols have been pursued in a much more lax manner? Well, at any rate, I think that these numbers and these facts just kind of indicate to me that the policies have been pretty scatterbrained, and now we have all these governors, particularly in the Democrat-controlled states, going into more aggressive lockdowns, in spite of the fact that the lockdowns have not been very effective in preventing them from getting in the shape they're in right now. I mean, it's very destructive to the economy. And then the big focus on restaurants, where it turns out the contact tracing that they've done in New York, that was published in the New York Times, hardly a bastion of conservative reactionism, have come up with a number that's about 1.5%, I think, of the cases were traced to restaurants, yet we're closing down restaurants. Why? I mean, it seems like most of these things are gathered in households or in social gatherings of people. And of course, that's a case where people are hanging around people that they know very well and therefore feel more comfortable around and probably aren't using the distancing protocols that you would be using if you were out with complete strangers. And so it goes to show that a lot of this, I think, falls in the category of when the government doesn't have an answer, they do something to look like they're doing something rather than just admitting that there's not a whole lot they can really do about the situation. It's an infectious disease, and it will be spread. The other thing I get is that the vaccines are out, both the Pfizer and the Moderna vaccines, which I guess will give us roughly dosages for 40 million people will be available by the end of the month. Now we're down to kind of a distribution of it and the inoculation process. And there's been some dispute about what should be done with this. I hold the viewpoint that I think it makes sense to inoculate the healthcare workers, particularly those that are involved in the COVID wards in any way, shape, or form, and people who are caregivers and employees of nursing homes. Because if those people are inoculated, then they won't be getting it themselves as much, and in the nursing home cases, won't be giving it to the patients as much. Beyond that, I would suggest that, of course, then the patients of the nursing homes and probably healthcare workers and first responders in general, because they're out there and having to have all kinds of contacts with people that they have no knowledge of their condition, and I think that makes sense. Beyond that, I think mainly going after inoculating elderly, and particularly those with the known pre-existing conditions that lead to a more adverse reaction. If you stick to this policy and don't play politics about race and other things, because after all, if a person, say, is African American and they actually do have diabetes or high blood pressure and are elderly, they're going to be just as eligible as anybody else of any other race. But on the other hand, if there's no reason to be giving this to 25-year-old athletes who have no known pre-existing conditions, as opposed to the elderly, because the athlete, if they get it, is just going to be sick for a few days and will recover, whereas the older person might end up in the hospital at a minimum, using up available space or even dying. So, I mean, if we stick to rational use of the vaccines, there's enough out there by, say, the end of January, I would think, to pretty much knock the death rate down to a pretty low level. It's been surging pretty much in recent days, and I think that if we would focus on those approaches, we could get the death rate down into the low hundreds very rapidly, and then and the remaining cases, which might remain high, won't be that devastating to the people that have them. And then we could focus, of course, on inoculating the whole population as it becomes available and as people feel comfortable getting the vaccine. I understand a lot of people don't feel comfortable about it. I'm not sure exactly why. However, by the time most of you will be able to get it, almost the entire healthcare community will have had it. So, I mean, we will see from that what kind of reactions they have. It looks to me like anybody that even has an adverse reaction is less than a relatively mild case of the disease, though. At any rate, I believe I would point out that I may have had an early case of the disease, which probably came to me via California very early, before anybody even knew it was loose in the country. But it had all the reasonable characteristics of it. It definitely wasn't an ordinary cold, and it definitely wasn't influenza. And I did have a fever of 103, and I was pretty listless for several days. Missed a couple of days of work over it. So unfortunately, I came down with it on a 3-day weekend. So I was pretty much out of it for about 5 days. So I think it was that illness. And what I'm saying is I doubt the reaction that most people are going to get from it will be as severe as that. And there's always reactions to a lot of vaccines anyhow. I mean, there's flu vaccines can have reactions too, and other things. And so, but anyway, I guess everybody make their own personal decision on that subject. Although I think, to me, the best thing we can do is get the population inoculated, get this disease knocked out as quick as possible, so that we can get these restrictions lifted and get the country somewhere back to normal, and thereby take the power away from all these people that want to tell us what to do. Well, anyway, I'll close this for now. Remember, if you like these videos, if you're on YouTube, go ahead and subscribe, and you can click that bell so you'll be notified. And you could, if you have a Google account, it's pretty easy to get set up for YouTube also, if you're not already, and or just forward the links to the videos to friends or anybody that might be interested. Well, I'll close for now.